Hello, and thank you for joining us for this podcast today. Surgical gloves, do they have you covered? Where we will discuss the importance of selecting the right glove for your hand for the protection of you and your patients. I'm Dr. Rosemary Babo, the Global Medical Science Lead for Cardinal Health, and I will be your moderator. So let's begin. How about if we have each of you outstanding physicians introduce yourself and give the audience a little splice of your life?
So I'll go first. I'm Parth Raleigh. I'm an associate professor at Temple University Hospital, Philadelphia. I'm a pulmonary critical care physician by trade. I spend 50% of my time in taking care of sick ICU patients, and I've been with my place for 7 years in practice. Happy to be here.
Yeah, hello everybody. I'm Emanuele Kizzeri. I'm a physician by training. Spend most of my time at Rotman Institute doing research in orthopedics and medical microbiology. Today, I focus most of my research in the role of microbiome in infections and disease.
Great. Thank you so much. I really look forward to your perspectives with such great backgrounds. Let's begin. Dr. Raleigh, we often think of surgical gloves in the operating room. However, you're very familiar with surgical gloves in other parts of the hospital. What do you think is significant about the surgical glove performance in places such as the intensive care unit, where you often deal with very critically ill patients?
I think it's a great point, and I think you are so right that when we talk about surgical gloves, we talk about only surgeries, which are usually elective surgeries, which happens in operating room. But you have to remember that a lot of patients who come for the surgical procedures in the operating room are coming for elective surgery, so they are not coming sick going into the cases or going to the OR. They're elective surgeries. Those are healthy patients. Absolutely, we need an absolute need for surgical sterility in the operating field. But where I practice is a complete opposite. I get patients from everywhere. I get patients from community. I get patients from other healthcare facilities. And those patients already have a primary disease that they are being admitted in the ICU setting. So when those patients become further sick and we need to perform a various procedures, for example, like chest tube placement, we perform central lines, A lines, dialysis catheter to need support. Sometimes we perform procedures like ECMO. These are an additional invasive procedures which involves additional invasive catheters. I think doing those procedures sterile way is the most important thing that you can do, because if you don't, you are adding a fuel to the fire. So I think the last thing that you want to be mindful is to give them a healthcare associated or a bloodstream infection from not using the sterile, not doing those procedures in a sterile setting. So I think from the physician perspective and from the patient's perspective, I think use of surgical gloves is equally utmost of priority and importance, whether you are in the OR setting or somebody like me who works in intensive care unit day in, day out. So yes.
Well, thank you. And Dr. Chisari, as a surgeon concerned with protecting your own hands as well as the health of your patients, as Dr. Raleigh mentioned, from infection, what can you tell us about your view on double gloving within the operating room?
Yeah, no, it's a great question. It's still something that is still debated, especially depending on the surgical specialty. At Rotman, most of the surgeries are related to orthopedics, which is a field where double gloving now has become a standard of care. Sometimes, actually, a lot of surgeons prefer to do triple gloving or, use multiple layers of gloves depending on the stage of the procedure that they are facing. Today the evidence really says how double gloving is fundamental to avoid any contamination and also additional risk from any puncture or any, damage that you can have from it to the outer glove. Also, if you're using a contrast colored under glove, that really helps you to notice and identify those sorts of contaminations, those lesions that can happen during normal process of doing surgery. So that's something that I think it's very important for any surgical specialty, even for the ones that are not using, power tools or, sharp material all the time, having a contrast under glove will really make a difference. And there are a lot of papers and publication on the topic that already prove this. Additionally, it's another layer of protection for yourself. So even though, the glove itself is not going to protect you from major injuries, it can help you notice early those changes and therefore act on it.
Great points, both Dr. Cesari and Dr. Raleigh. And kind of bridging off what you were talking about, Dr. Cesari, as an author of an excellent recent article on intrasurgical contamination, what do you think affects the microbiome when you do a glove change during a procedure?
No, it's a big effect. We basically try to study how the glove not only get contaminated during surgery. That's something that almost every surgeon today knows. But the reality is that gloves are also a source of cross-contamination. So within the surgical site, anytime you do a surgery, even a surgery that you consider clean, you have a limited amount of bioburden that still exists always, no matter how much antiseptics you use, no matter how much antibiotics you use, you're going to have bacteria that is present in the operating room, that is present on the surgical site, on the skin of the patients, on your skin, and so on. So the practice of changing gloves frequently, and in our study, we were looking at something between 15 and 30 minutes. It's really, a time window that you should consider, because especially in infected, surgical site, but even in clean surgeries, you need to consider that bioburden, that microbiome, as you said. So bacteria are present on your gloves. The more you use them during the surgery, the more bacteria will grow and will be present on your gloves. And the more your gloves could be a source of cross-contaminating the fields. So I touch a tool, then I touch the skin of the patient, then I touch the surgical side, then I touch, my scrub, or I touch somebody else's gloves. So it's really something that you need to be mindful of, in the same way Dr. Raleigh was talking about this in his own practice. So very important point.
I think on the piggyback on that topic, I think as we are talking about, I think double gloving is so prior importance, and the gloving itself is super important, because at least I'm not aware of that any institution has policies how your hand hygiene should be as a providers, right? I mean, nobody tells me whether I should even cut my nails. My nails should be like this or this. So I think, again, it sounds very stupid and silly, but I think when you talk about, I think Dr. Cesari was talking about, is that double gloving, because you don't know what you are even walking with. And then all of a sudden you scrubbed in to do a sterile procedure. And I think that's why double gloving, even in ICU setting, even though we are not doing surgeries, I think even in ICU setting, in a certain high risk invasive procedures like placing a chest tube or even doing an ECMO, we routinely perform double gloving for the same reason. And I think what also happens that when you are surgically creating a sterile field, the last thing that you put on is the gloves. And it just becomes, you destroy the whole surgical field. And sometimes people use the shortcuts, and that's not you're supposed to. I think that's why also the double gloving gives you that extra advantage of having extra layer of protection to your and your patients both. So.
Excellent. Very good points, I think, on all aspects of that. And before we conclude, I do have a couple of questions I'd like to ask you both as it relates to your practice. When you wash your hands as frequently as we do in healthcare, are there important elements to reduce bacteria and actually keep your skin intact when choosing a surgical glove?
Yes, I'll go first. I think there are different thought processes that I think goes when you are using or selecting the surgical gloves. In my opinion, I mean, is the type of material you're using, latex based versus vinyl based versus nitrile based. So the glove thickness is extremely important to us. Also, I think double gloving, I think we have talked about that. And also you have to remember that the gloves, I think, as Dr. Cesari mentioned, you're not only using for yourself, but for your patients. Example, the latex gloves are great, but you may be okay, but your patient may not be. So I have several patients that I see in my practice who I have latex allergies that I may not know. So I think I think that's kind of a big part of our decision process. What kind of gloves that you use? Those are the important topics that we always pay attention to when you are performing the sterile procedures. I think hand washing, is I think in ICU setting, I think it's extremely important. Something that gets ignored pretty frequently when patients are sick. But I think healthcare advisors do a good job. Sometimes we call it secret police, and there are patient people who are just watching you, and there is a report that will come through. And I think it just shows the fact that so much we can do as a team together. But I think OR setting, maybe you're going into scrub into one OR, but like what I see, we are literally changing to room. I think hand hygiene and practicing and doing thorough clean wash, I think extremely important.
Yeah, no, these are all good points. That, one thing that Dr. Raleigh said a little bit earlier is that there is no policy about, what you should do with your hands, in your normal daily activities, and how this can affect, your practice as a surgeon, as a doctor, as a nurse, whatever is your role within an healthcare institution. That's the same for many things, and hygiene is just one of them. We can talk about nose colonization, we will talk about, how other parts of our body can harbor bacteria, there can be, or even fungi and viruses that could be dangerous to our patients, every day. But what can be easy to understand is that if you have cracked skin, if you have an healthy skin barrier on your hands, obviously those are going to be areas where bacteria are going to grow easily because there is accessible nutrients, for example, coming from blood, or because those areas are actually infected because you have some nail infection or other type of infection within your skin. So maintaining an intact skin barrier is essential to your health, and the same way to the bacteria that you're going to harbor on your hands, and therefore the risk of contamination that you can give to the patients that you work with. So in thinking on all of this, obviously you want to take care of your hands in multiple ways. And using normal hygiene products at home could be one of them. And obviously in the hospital, especially if you are a surgeon, but even in any other role in high intensity units, for example, you will have access to antiseptics that help to lower the bioburden. Sometimes can be more harmful than good, but in general practice, I think it's a good idea to use them and be very careful about how you wash your hands. But also there are all these different options today, including the one, the Cardinal Health came out with, for gloves with Neoterra. And the reason why I mentioned these ones is because I specifically found interesting how some of the ingredients, like glycerin and provitamin B5, are actually ingredients that obviously you can find in a lot of skincare products. But the reason why you find them in a lot of skincare products is because they have a beneficial effect on the skin barrier. So exactly the topic that we're talking about today, and to the microbiome of the skin. We are actually discussing about doing a study on this just to prove that that actually happens with the gloves specifically. But in theory, having that extra help to maintain intact skin barrier will avoid the shedding of cells together with bacteria, and therefore avoid the increase of risk of contamination during any surgical procedure or any contact to the, any surface or any patients during our practice.
Thank you so much for bringing that up, because I don't think clinicians even think about what the ingredients are in their gloves that could be beneficial. And coming back to clinician, if you just have to put on what the hospital gives to you, do clinicians, from your experience, have a voice in what they put on their hands? And what would your advice be to our audience in getting a glove, like you mentioned, that has the extra ingredients that you want?
I'll start there. I think you should, because I think at the end of the day, we are taking care of the patients, right? So I think that's of prime importance. So I think we do, at least at my place, we have, I think the way the health system works is you have to get involved, right? So I think you have to channelize the energy, right? So if you have to, I think the way I would advise anyone is that if you notice that there are barriers to improve, I think become a part of process to change it. I think get involved in the committees, because there is someone in your hospital who is making the decision, and they may not be making the decision based just sold on the points that you have, that you provided the patient care. So I think they need help. So I think it always comes down that sometimes it's easy to say, I don't make my decision, I just put it on what I want. But I think it's up to us to make our healthcare administrators make the right decision. So we do have committees where time and again, if I want to make change, have the changes today, it won't happen. But I think you have to kind of identify the deadlines and the budgeting and the process and the vendor selection. And I think there's a whole committees that do exist at the majority of the hospitals. I think you have to get involved to change the processes if you are not happy with it. So.
Yeah, I think the only aspect I will add is that whatever it is the decision process, just make sure that that decision is made in an informed manner. That's really what matters. So if you can advocate and you can, bring the evidence, support the decision, with looking at publications, at all the articles that have been made on the topic about double gloving, about, what kind of glove you should use, what are the ingredients that can benefit your skin or patients and so on. Really, that's the important part of the decision process. Doing decision without any evidence, that's the problem about healthcare in these cases.
Well, thank you both so much. And that's it for this podcast. So thanks to Dr. Raleigh, Dr. Jasari for a lively discussion on the importance of infection prevention and hand well-being as it pertains to surgical gloves. Until next time, I bid you adieu.